Hi everyone, Dr. Remy from Pain Free and Fit. Today, a great excerpt from my new book, Walk Away Back Pain. We're going to be talking about how to use your arm and leg swing during walking to help reduce the pain associated with disc herniation, bulges, and degeneration. Hope you enjoy. So those of you with disc herniations, bulges, and degeneration of the lower back have probably heard from your doctors or therapists that flexion or bending forward is very compressive and probably the most irritating motion on any type of disc problem. When we sit and bend forward or slump forward especially, it increases that disc pressure up to 12 to 13 times our body weight. So many techniques and exercises have been developed to increase extension or a more upright posture on the low back to relieve that disc pressure and take the fluid that's inside and take it from having a backwards placement and center it more in the middle of the disc, which helps relieve symptoms. Walking, it's been shown through many studies, is excellent for chronic lower back problems. In fact, extension exercises, extension endurance exercises, building up the time that you can use your muscles to extend or get straight, has been proven to help many chronic lower back pains, including those with disc problems, degeneration, herniation, and bulges. However, most of us don't think about using rehab during the day when we walk around. Most of us take 5,000 to 10,000 steps a day, and this is a crucial time and a great opportunity to include rehab exercises of the extensor muscles while we walk. Because conversely, if we're not thinking about our form while we're walking, many times we walk with what's called a flexion dominant pattern, where if you notice from the side as people walk, there's a lot more leg forward motion than there is leg backwards motion from the opposite hip. And as a result of this, we're training our flexors, our hip flexors. We're inviting more of a flexion posture as we walk. So that's training through a posture movement habit every day, this flexion problem or this flexion repetitive stress on our discs. So to correct this, a simple way, either during your fitness walks or just being mindful while you walk around during the day, is using extension. Meaning we're going to make that leg push further back than the opposite leg is stepping forward. By doing this, we're going to be using the buttock muscle a little bit more, the hamstrings, and the extensor muscles, the erector spinae, the multifidus in the lower back, and that is going to help increase that arch of the lower back and resist that flexion deformity. The other tip that you want to use besides moving the leg back a little further or keeping it back a little longer, which will have the same effect, it will increase the range of motion or the distance of hip extension, is when the opposite arm swings backward to meet that leg, emphasize the distance traveling back with that arm. Again, many people walk with their arms stiff with disc problems. By using that arm swing and cadence, we're going to increase extension from the lat muscle. As the arm swings back to meet the opposite leg during the walking cycle, the latissimus that runs from the shoulder to the lower back contracts and helps again to arch or increase extension in the lower back, taking pressure off the disc and helping to recenter that disc material that many times helps relieve symptoms. If you like this tip on walking for disc problems, feel free to subscribe to our channel. We've got a lot of great tips out there for disc problems and healing exercises. If you're looking to even learn more about how walking can help with your disc problems, check out our new book, Walk Away Back Pain, at the painfreeandfit.com website. It's a over 200-page book based on over 200 references, scientific studies that show how walking can help many types of lower back pain, including disc herniations. We have many chapters that deal with walking tips and exercises, supportive exercises that you can do before or after your walks, nutrition for disc problems, and even components of the psycho and social complex of chronic low back pain. It's chock full of great information and can really help you put together a walking program for yourself to help with your disc pain. I hope this video on extension walking and disc herniations, bulges, and degeneration helps you with your chronic lower back symptoms.